the way, I want to thank all of you this evening for being here tonight. If you're not familiar with the Fenway Foundation for Friesian Horses, we are a nonprofit 501c3 based just outside of Appleton, Wisconsin in the United States. And we are dedicated to enhancing and preserving the health and longevity of Friesian horses through three primary focus areas: research, rescue, and education. And tonight we have a fantastic educational webinar for you on equine eye diseases. And we're going to talk about some Friesian specific eye diseases as well. And our presenter tonight is Dr. Kelly Knickelbein from Cornell University. Dr. Knickelbein is a graduate from the University of Pennsylvania School of Veterinary Medicine. She completed an internship in equine medicine and surgery at Rhinebeck Equine and a comparative ophthalmology internship at the University of California, Davis. Following this, she completed her residency in comparative ophthalmology. Following this, she is a diplomat of the American College of Veterinary Ophthalmologists. She thoroughly enjoys the comparative nature of ophthalmology, and her primary interests are equine ophthalmology, heritable ocular disorders, and ophthalmic imaging. So now I would like to turn the presentation over to you, Dr. Knickelbein. Welcome, and thank you so much for being with us here this evening.
Thank you very much for having me, and thank you for the intro, Angie. I appreciate it. Just kind of the basics of genetic diseases in horses. Genetic diseases are those that are caused either in whole or in part by a change in the DNA sequence away from what's considered the normal sequence. And these diseases may or may not be present from the time of birth. A lot of genetic diseases are present from birth, but some are not, and some may not manifest until adulthood. And then when we're dealing with genetic diseases in horses or diseases that we suspect are genetic, we kind of look for breed association. So whenever we see a certain disease happening in a certain breed more frequently than we see it in other breeds, that's when we get suspicious that that disorder may have a genetic basis in that breed. One example of a disease that may not manifest until adulthood, even though it has a genetic basis, is actually the ocular surface squamous cell carcinoma in Haflingers and Belgians and the few other breeds listed. These horses have essentially a defect in a protein that is involved in repairing UV damaged DNA. So anytime we're out in the sun, we have exposure to UV light, it does damage our DNA. We have internal mechanisms to try and find that damage and correct it so that we don't get skin cancer or, eye cancer, those kinds of things. These horses that have a genetic predisposition to ocular surface squamous cell carcinoma, one of the proteins that's involved in kind of scanning the genome to find that damage and call in other proteins to help repair it is defective. So they're unable to even find that they have this damage, and thus they're unable to repair it. So they're born with the defect in that protein, but they also have to have lived for a little while, had the sun exposure to accumulate enough damage to develop the tumor because they lack that protein that can't come repair it. So just one example there of how a genetic disorder doesn't always manifest from birth. Okay, and Friesian horses are certainly not the only, breeds that are only breed that is impacted by heritable or genetic ocular disorders. There are a number of ocular disorders that are well documented as being genetic in many different breeds. So I have several of them listed here. Those that have an asterisk are the diseases that actually have a genetic test available for them. So we'll talk more about distichiasis and bilateral corneal stromal loss. Other known genetic disorders that affect the eye in horses are multiple congenital ocular anomalies, and this is associated with the silver coat color in Rocky Mountain horses and several other breeds. That disease has kind of two forms, a more mild form and a more severe form. The more severe form certainly does impact vision. And so the fact that we have a genetic test for that is excellent to try and kind of, breed away from that severe phenotype, but still preserve kind of the desired traits in that silver coat color. Congenital stationary night blindness is another. There's actually two forms of that disease, one in Appaloosas and then another in Tennessee walking horses and standardbreds. And this disease is a disease of the retina, where these horses actually cannot see in really dim light or at night. So their day vision is totally normal, but they have essentially no functional vision in really dim light conditions. And this is certainly a condition that's underdiagnosed. A lot of people don't spend a lot of time with their horses in the pitch black. Usually they have lights on or are working them during the day. So this is a really interesting one. Ocular surface squamous cell carcinoma, we've talked about quite a bit already. There is a genetic test available for the breeds listed here. And then uveitis is another. There is a genetic test, so it's the same test for the leopard complex spotting coat color in the Appaloosas and other breeds with leopard complex spotting. There is not currently a genetic test available for the warm blood breeds. And then cataracts are known or suspected to be heritable or genetic in many breeds. We do not currently have any genetic tests available for cataracts in horses. Okay, moving on now, we'll talk more thoroughly about distichiasis and then bilateral corneal stroma loss. The photo on the bottom left here, I have an enlarged photo on a slide coming up, so we'll chat more about it there, but that's an example of distichiasis. And then the image in the middle is a horse with bilateral corneal stroma loss, obviously showing just one eye there. Okay, so distichiasis describes a condition where the eyelashes are, instead of growing out of the kind of skin away from the eyelid margin, these hairs, also called cilia, are growing directly out of the eyelid margin. And they're actually growing out of little glands that are called meibomian glands. Those glands produce a part of the tear film. So the meibomian glands are a normal structure. They create a fatty, oily part of the tear film. They do not normally have hair growing from them, but in this condition, distichiasis, they do. And if you don't mind advancing, Angie, I think it should bring up, yeah, some enlarged photos. And then there's one more, if you could advance one more time. So these enlarged photos allow you to hopefully see these black hairs that are growing right out of the eyelid margin there. And you can imagine if you've ever had anything on the surface of your eye, you know how irritating that can be. So just imagine having these coarse little hairs just constantly touching your cornea. These can be a cause of pretty, severe discomfort and irritation for some animals. The hairs that are kind of long and fine, like the ones in the image on the right, these ones are kind of pointing out a little bit more. These ones maybe are not so irritating, but the ones on the left, those kind of short, fat little hairs that are really firm, these can be really, really irritating for horses. Just another example here. This horse is kind of looking over to the other side, allowing the distichia to overlie the conjunctiva instead of the cornea, so you can see them a little bit better here.
What's interesting about this is you imagine when you hear this disease described that there's all of these aberrant eyelashes coming all over the place, poking, the eye. But, as you can see in this picture, it could just be, a small number that I think would be very difficult as an owner to observe visually. Is that correct?
Yeah, absolutely. The severity of this disease in terms of the number of aberrant hairs can be really variable. There are certainly some horses that have a ton of hairs, and there are some that have just a few. And seeing these with the naked eye is really, really difficult. So, if they aren't bothering the horse, if the horse doesn't have irritation from them, it would be really easy to overlook these. And this is an example of a horse that, despite the photo, only having a few, this horse was really irritated by the Distichia and had numerous corneal ulcers and corneal inflammation and quite a bit of scarring of the cornea as a result of these Distichia. One reason why, there may be only a few hairs seen in some of these images, it may just be that these horses have less severe disease. But the other kind of important thing to realize with this disease is that these hairs do grow and fall out just like any other hair would. So at any given time, you can have hairs in kind of different stage of the hair growth cycle. And just because there's not a Distichia kind of in one portion of the eyelid today doesn't mean that there's not one in there growing that's going to come out of the lid margin at some point. So it's always hard to know, how many of the meibomian glands are truly growing hairs or not. So clinical signs of distichiasis are kind of the standard non-specific signs of an eye disease. So squinting, holding the eye closed. Sometimes they'll rub and their eyelids will become swollen. They'll have excessive tearing. They'll have a corneal opacity, so a cloudy eye due to corneal inflammation. And some horses will develop corneal ulcers, and then those ulcers can cause scarring. So kind of the classic corneal signs are what we expect for this. Treatment options for Distichia, so kind of focus around removal of those hairs. Epilation is a term that just essentially describes plucking, so pulling the hairs out. Pulling them out does not address the hair follicle that's causing the hair growth. So if they're just pulled, they will regrow. So one option, if they are irritating, would be to epilate them. I mentioned already that, there may be hairs in different stages of the growth cycle. So it's not like you can pluck them all at once and have all of them be removed for the same period of time. They're going to grow at different rates and they're going to be present at different times. So not a great option, also not very well tolerated by most horses, as you can imagine. Electroepilation and cryoepilation are the other options. So electroepilation aims to destroy that hair follicle with heat. And then cryoepilation, kind of similar process, aims to destroy that hair follicle with freezing. And this is a kind of a particularly unappealing treatment option for many Friesian owners because the cryotherapy usually does result in the lid becoming depigmented. That is often temporary. The pigment usually returns to the lid, but there is some risk that it could be a permanent change. And so obviously our beautiful black Friesians, we don't want them to have white spotted eyelids. And so not the best, treatment option for the breed, unfortunately. The important thing to realize with either of these, either the electroepilation or cryoepilation, is that by destroying that follicle, we're also probably going to destroy the meibomian gland itself. And those glands are important to the normal health of the tear film, health of the cornea. And so it's not, a treatment that is without any risk. If we destroy enough of those glands, it could impact their corneal health as well. So just something to think about there.
I have a couple questions.
Yeah.
Laura wants to know, will horses with distichiasis more commonly have issues in both eyes, or is it possible to just have the distichiasis in one eye?
Yeah, that's a very good question. Most often it's both eyes that are affected. I'm sure there's a horse or two out there that may just have Distichia in one eye, but most commonly it affects both eyes. And interestingly, in the one study that we'll talk about there, the lower eyelid is more commonly affected than the upper eyelid. And that's interesting to me because the lower eyelid actually kind of lacks true eyelashes in horses. The upper eyelid has a lot of them, but the lower eyelid lacks those true eyelashes. So it's interesting that the Distichia tend to be more common in the lower lid.
Well, the next question is, can you give us an idea of like the cost for these different treatments?
Yeah, that's a really good question. That will certainly depend a bit upon your vet, and what they charge. But luckily, these are procedures that can be done standing, so with just sedation and some local and topical anesthesia. So we're talking in the probably couple $100 range, not couple $1,000 range.
And the next question is this a one-time treatment or does it have to be done multiple times?
Yeah, that's a really good question. Actually, if you want to go to the next
Okay,
slide, I think I have a little, yeah. So this
there
is
you go.
a retrospective that looked at treatment of equine distichiasis. And it says with a special reference to the Friesian horse because 17 of the 18 cases were Friesians. These, of course, were horses that were presented to the hospital for evaluation. So all of them had clinical signs, which is why they were presented. About half of them, so 45%, did have corneal ulcers that were thought to be associated with the distichia. And they were treated with electrocautery, and about 54% had recurrence. So hopefully that can answer your question that it's not a perfect treatment. The goal is to, destroy that hair follicle. But again, we don't want to, kind of fully destroy all of the meibomian glands. So depending on how severe they are, it's possible that we're either under treating or that the follicle is just not dying with the amount of electrocautery that we're willing to do on the lid. So recurrence is definitely a potential.
Okay, I think that answers all the questions for now.
Awesome.
Do you want to advance to the next slide?
Yeah, yep. So what do we know about the genetics of distichiasis? We do know that there is a large deletion on equine chromosome 13 that is associated with this disease. That large deletion and the genetic work that has been done suggests that it is inherited as an autosomal recessive, meaning that you have to have 2 copies of the large deletion in order for distichiasis to manifest, but that it's incompletely penetrant, meaning that even if you have those 2 copies where you have that large deletion, you may not have distichiasis. So kind of complicated here. If you want to advance to the next slide, we'll kind of talk through the genetic work that was done to try and sort this out. So a genome-wide association study was done. And what that means is that essentially the genomes of horses with distichiasis, so Friesians with distichiasis, were compared to the genomes of horses that were confirmed to not have distichiasis. And then we look for differences in those genomes. So what part of the genome is different in horses that have the disease versus those that don't have the disease. And we use markers that are kind of spread out across each of the chromosomes to kind of point us in the right direction of where we should look within the genome. So this was the genome-wide association study that was performed by Dr. Ballone's lab, which showed kind of 2 peaks of interest, one on equine chromosome 5, so the pink there. You can see there's kind of a high peak. We call this the Manhattan plot because it looks like a cityscape. So the taller the building, the more significant that area of the genome in terms of it being potentially associated with the investigated disease. So the peak on 5 is of interest, and then the peak on 13, which is in green, were of interest. And this study used 14 horses confirmed to have distichia and 38 horses confirmed not to have distichia, all Friesians. You want to go ahead and advance to the next slide. So what they found was that the region on chromosome 5 that seemed to be significant didn't actually hold up when they tested it in a higher number of horses, but the region on chromosome 13 did. So that seemed to be the most associated. So a few horses, 3 affected and 2 unaffected horses underwent something called whole genome sequencing, where their entire genetic makeup is sequenced, and then that sequence is evaluated on software. So what you're seeing here is actually the sequence evaluation, and the top 3 horses had Distichia, the bottom 2 did not. And this is representative of that large deletion on chromosome 13 that's been associated with Distichiasis. So each of the horses that were sequenced that had Distichia lacked this area of their genome, had this large deletion, whereas the 2 normal horses did not. They had, they had DNA there. They didn't have the large deletion. And so then this area was sequenced in a larger number of cases, 19 cases, and it was found that 18 of those 19 horses with Distichia had this same deletion. The deletion is in kind of an intergenic region, and what that means is that there aren't genes in that area that we know of. So genes are kind of the regulatory factors that make proteins, which function to kind of control all the different, processes within our bodies. So no known genes in this area, but it must have some impact on the genome for this area to be missing. And what that is, we just don't know yet. So it's not known if this deletion is actually what causes Distichia, or if this deletion is just inherited, with whatever is causing Distichia, and it's a marker for the disease. Regardless, the fact that 18 out of the 19 affected horses had this deletion and that none of the control horses did indicates that it is significantly associated with the disease, and it's appropriate to use it as a genetic marker, a genetic test for Distichiasis. If you don't mind advancing, Angie, on that note, there is a genetic test available. Dr. Ballone spoke to the group. When was that, last summer? Must have been last summer.
I think it was last year sometime.
Yeah, kind of about the development of this genetic test, and it is commercially available through the UC Davis VGL, if anyone is interested in more information there. So we'll move on now to bilateral corneal stromal loss. So this is a very strange disease that so far has only been recognized in Friesians. There are some kind of reports out there, nothing published that I'm aware of, but some reports of halfwingers potentially having a similar type of change that can occur to their corneas. But what you're seeing here is essentially little holes that are developing in this horse's cornea. And these can go from being kind of not noticeable to causing a perforation, so a full thickness defect, really, really quickly. If you want to go ahead and advance, we'll talk through kind of how this condition was discovered. And I purposely made this photo kind of small, because I know it's going to gross a lot of people out. So this is a kind of retrospective case series out of the University of Pennsylvania New Bolton Center from Dr. Mary Lasseline that was published in 2014. So she, along with some colleagues who were practicing kind of all over the world, recognized that they were seeing Friesians commonly with either corneal perforations or these really deep defects in their corneas that didn't really have the typical clinical signs of a corneal ulcer. So they're not really painful. They don't have inflammation of their cornea. They don't have inflammation inside of their eye. Often these eyes are wide open, no discharge, but they have a hole, a progressive hole forming in their cornea. And it affects both of their eyes, though the onset may not be at the same time. One eye may happen first, and then the other eye may happen weeks, days, weeks, months, years down the line. The average age of the affected Friesians was 10 years. Interestingly, 8 out of the 9 cases were male, so definitely a male predisposition. And then unfortunately, about half of the eyes, truly half of the eyes, 9 of the 18 eyes did perforate, so developed a full thickness hole. Many of them did undergo surgical repair and were able to maintain vision, but it's a really inflammatory and painful process for an eye to perforate. So based on the fact that this was seeming to happen just in Friesians, a pedigree analysis of the affected cases was performed. And each of the affected horses in this study could be traced back to a common ancestor of the Tetman line. So again, this seems to be a spontaneous disease. These horses lack any known trauma that might incite this change to the cornea. And we do know that it's progressive. A variable age of onset. Some horses were younger, some were very old, but an average age of 10. Males definitely more affected than females. Again, it may start in one eye and then affect the other, though some horses present with both eyes affected, and they tend to lack signs of discomfort as well as corneal and intraocular inflammation. And I think you can get kind of a hint of that with the photos here, of the eyes at the bottom. These eyes are just wide open. The pupils are, kind of a normal size. The pupil in the right eye, which is the left image here, had been dilated. That's why it's bigger. But this cornea, so these eyes have not ruptured yet. This is a very, very deep ulcer present here. But this cornea doesn't have that same cloudiness that those eyes that had ulcers, a few slides back at the beginning had. So the stromal loss is happening without a lot of inflammation going on around it. And we don't know the reason, why this stromal loss is happening.
So we don't know if it doesn't appear to be from an injury, or like in a case of an ulcer from a scratch where it gets infected and then that gets out of control. That
Exactly.
doesn't seem to be what's happening here, correct?
That's exactly right. Yeah, they lack those indications of, they lack the history of trauma. They lack any indication of infection. Often when there's an infection in the cornea, we do see the cornea becoming thin. However, we also see a lot of cells coming into the cornea, blood vessels coming into the cornea. And often that corneal infection induces a lot of pain. And these eyes are wide open, comfy, despite the fact that they have this loss of stroma. So
I've read a few of the papers on this, and I did note that there was mention in at least one paper of a possible connection to connective tissue. Do you recall reading that? Or
yeah, we're going to talk a little bit about that. If you want to go ahead and advance, it may even be a few more slides. I should, if I don't bring that up again, remind me and we can chat about it, but
no
I'm
problem.
pretty sure I'll talk about it. So this is just an example of how this this disease can occur. So this horse's history, this is a middle-aged Friesian gelding. He presented for an ulcer in his right eye in March of 2016. That eye had a lesion consistent with bilateral corneal stromal loss, even though, the one eye was affected at that time. So he had surgery on his right eye. He had a conjunctival pedicle graft performed. It was successful. His left eye was very closely monitored throughout his time in hospital for surgery, and it never changed. So the photo on the left is from, that time when his right eye had surgery. He has a nice, healthy, clear cornea here. Sure enough, 6 months later, we had advised his owner, this often will go on to affect the other eye. You need to monitor him really closely. Here's what to look for. Look specifically in this spot. Sure enough, 6 months later, he was back because he had this little divot in his stroma here, so indicated by the white arrows. And he stayed in hospital with us. Over the next few days, this progressed, it got deeper. And so he had surgery on his left eye as well. So just an example of how this can start as a unilateral disease affecting one eye, and then, in the future, go on to impact the other eye. So treatment, monitoring these eyes very closely is super important because they can develop corneal perforation, really, really quickly. They can lose stroma quickly and essentially perforate in a matter of hours to a day. Because it's a bilateral disease, that can be incredibly problematic, especially if the horse has any, concurrent issues that may not may make it not a great candidate for surgery if it needs general anesthesia, that kind of thing. And so if there are bilateral perforations, that's a reason that a horse would actually need to be put down from its ocular disease, which is not very common. So surgical stabilization of the cornea is considered the gold standard, and the surgery that's performed is really going to depend on how deep the lesion is at the time it's assessed, as well as just the surgeon preference that's treating the case. But we do know that these tend to respond well to conjunctival pedicle grafts. So that may be kind of the sole treatment that's recommended, or the conjunctival pedicle graft with some other sort of graft underneath it, like donor cornea, or some of the synthetic grafts that we have may also be a recommendation. So this is a horse, this is actually the horse I referenced earlier, that had bilateral conjunctival grafts performed at different times. These grafts, as opposed to the one I showed earlier with the corneal perforation, have pigmented. So they've developed kind of dark brown to black pigment on the surface, which actually makes them look a bit more cosmetic. There's not that kind of pink slug sitting on the cornea. In these cases, I typically advise that we not trim the pedicle, mainly just because we don't know what's causing this stromal loss. And so leaving the blood supply there, I think, should the horse develop any issues around the graft site in the future, leaving the blood supply there is only going to help us. So this is one condition where I would advise against trimming the pedicle, unless it's thought that the horse is having significant visual impairment from the graft, in which case may consider doing it. Okay, so relation to other collagen disorders, and Angie, hopefully this will kind of answer your question. So we know that Friesians have, genetic disorders that affect collagen elsewhere, dwarfism with joint laxity, megaesophagus, hydrocephalus, potentially others. So is this eye disease potentially a manifestation of, kind of the same underlying issue with collagen that they may have? If you want to go ahead and advance, this was investigated. It's a really good kind of working hypothesis that all of this stuff could be related. So this was investigated by Dr. Rebecca Ballone's lab, with the knowledge from the initial case series that males predominate. 8 out of 9 cases in that were male, suggesting that this could be X-linked. So this could be a condition that is due to a genetic variant on the X chromosome that would kind of easily explain why more males are affected than females. And a solid candidate gene on the X chromosome is a gene called biglycan, or BGN for short, which is involved essentially in collagen regulation. So this gene was sequenced in a number of cases and controls, and they did find variants within the gene, but none that were associated with the disease phenotype. And most of them were fixed in Friesian. So every Friesian that they sequenced had those same variants. So kind of came up empty-handed here, but important to rule out this one specific gene that was a good functional candidate on the X chromosome.
Yeah, it's definitely very interesting because, as you know, we're studying megaesophagus at the University of Kentucky, and it's also been noted in other papers related to megaesophagus that have previously been published, and I think potentially aortic rupture as well, that there's a higher prevalence of male versus female cases. And it is very interesting to think that there's nothing obvious that's causing that stromal loss, like an injury or an infection. And it certainly does, at least theoretically, align where you could see a potential connection possibly. But the pathway that regulates collagen production is extremely complicated. There's a lot of things involved in it. So it's definitely all the low-hanging genetic fruit has been picked. So we are definitely working on these more complex diseases right now.
Yeah, absolutely. So kind of based on the fact that biglycan was ruled out, the next kind of logical step to investigate the genetic basis of this disorder was to do a genome-wide association study. So this is the same type of thing that was done for the distichiasis, where the kind of genetic material from cases, so bilateral corneal stromal loss affected cases, was compared to the genetic material of Friesians that were known to not have this disease. And the controls for this were horses that were older horses. So we know that BCSL, or bilateral corneal stromal loss, essentially can affect a number of different ages of horse. It can be a young horse up to an old horse. So our control horses were kind of at an advanced age, above the age of 20, to make sure that they, truly did not have this disease. And I was intimately involved with this research project during my residency, and I thought I had won the jackpot, because this is a nice looking Manhattan plot. We have a tall building on chromosome 19, and so I ran into Dr. Ballone's office and said, I think we found it. This is awesome. If you want to go ahead and advance. Oh, I forgot to put that there. Yeah. So that's me. That's me as a young, naive, genetic student. Yeah. I should preface this with saying I am by no means a geneticist. I'm a clinician by training, but I had the wonderful experience of getting to work closely with Dr. Rebecca Ballone, and through her, some other geneticists. So, have developed some understanding of genetic disease in horses and how to investigate them appropriately and that kind of thing. But my day-to-day is looking at horse eyes and trying to fix them. So, but what we found was that area of the genome that was marked in that Manhattan plot from the Genome-Wide Association study is what people call a gene desert. So there are like no genes there, like none at all. There's one nearby. It's a gene called LSAMP. And we sequenced that gene in a bunch of cases and controls and found nothing. We found a couple of variants, but none of them that, segregated with the disease phenotype. So we don't think it's associated with the disease. So kind of a bummer there.
Back to the drawing board.
Yeah, exactly. Back to the drawing board. You can go in and advance there. Yes.
Oh, sad. Yes, I have felt that feeling many times.
Yeah. So what do we know so far about the genetic basis of BCSL? We know that males predominate. The more cases we have, we do have more females coming in, but males definitely predominate. There are more males than females affected. However, we haven't been able to identify anything obvious on the X chromosome as associated with or causal for this disease. We know based on that genome-wide association study that we have a region significantly associated with the disease phenotype, but we don't have a functional candidate gene in that area. So we certainly, are not close to identifying the causal variant there. That said, the region in that area suggests that this may be inherited in an autosomal dominant form, because the cases, only 10 of the 19 cases had what we call the same haplotype, so the same kind of genetic makeup in that region, but they were heterozygous, meaning that they had one copy of it rather than two, and none of the control horses had the same genetic makeup. So it is significantly associated. What it means, we don't know at this time. And you can go ahead and advance again. So where do we go from here? We definitely need more cases. We have a fair number of cases, but we need more. It may be that our genome-wide association study was just underpowered, and that if we get more cases and more controls, we may be able to more accurately identify regions or a region of the genome that is, significantly associated and will lead us to that causal variant. We also could use whole genome sequencing data. So like they did with the distichiasis cases, we could sequence the entire genome of affected and unaffected horses and kind of scrutinize that. The problem there is it becomes harder than looking for a needle in a haystack. It's so much data. And so you have to go about it in a very organized fashion. And we certainly do have, a list of genes that we know are causal for or associated with other genetic disorders in Friesians. And there are ways to kind of go about it and try and find that causal variant. But it's also possible that it's not as simple as a variant that's inherited in a simple fashion, whether it be on the X chromosome or any of the other chromes. It may be that multiple genetic variants have to be present in order for this disease to manifest, or that there have to be one or more, genetic variants, but also exogenous factors, environmental factors, maybe not trauma, but maybe things like stress. If you want to go ahead and advance to the next slide, one thing that I've noticed in a few horses, and that's also reported in the case series, is that some of these horses presented with unilateral stromal loss and were hospitalized for that, either for monitoring or for surgery. And during the course of hospitalization, where it's incredibly unlikely that they would traumatize their eye, they develop, the stromal loss in their other eye. So it can happen in just a matter of days. And, there is a big question about what exogenous factors might be at play here. Could stress, lead to this disease manifesting? There's also a few kind of anecdotal reports, and then also a mention of it in the initial case series that there are a few horses that have been seen to have mild stromal loss that on re-examination later in life, usually years down the line, their corneas appear to look normal. So some of these horses may actually be having spontaneous resolution and kind of a waxing and waning disease course that does not progress to perforation. So there are a lot of unknowns about this disease. It's a very strange disease, a really interesting disease. But we hope to, be able to learn more about it as we go.
This is just more of a comment, not a question so much, but Donna says that she says, I guess I'm the lucky winner as my 22-year-old Friesian mare has this, and she has it in one eye at this time, but has lost the vision in that eye.
Oh, I'm sorry to hear that.
It can definitely happen in mares as well.
It can, yep. Yeah, we have, like I mentioned, the more cases we identify, the more females we're seeing, but the male predominance is still kind of holding up. Males are affected more so than females. So
that brings us to the questions. Yeah, so I guess while we're, I guess I will go ahead and let the audience know if you have questions or you're thinking about asking a question, please use the chat box in the bottom. I think that is such and I hate to use the word fascinating because it's certainly not fascinating or exciting for anyone if that happens to their horse, but from a scientific standpoint, it is a very peculiar disease, very, very interesting indeed, as far as all the factors that you described, and especially how quick it could manifest just in a potential stressful situation. That is kind of mind-boggling what might be happening there.
Yeah, absolutely. The case series that was initially presented compared it to a corneal, what we call dystrophy. Dystrophy is a term that's used to describe kind of heritable changes to the cornea, and it's probably not the best term to use, but compared it to a disorder called pellucid marginal degeneration, which is described in people, and it looks somewhat similar. They develop focal areas of thinning of the cornea. Males are more commonly affected than females. I don't know that they've identified a specific genetic variant for that, but it is, I believe they think it to be X-linked. So, during the initial stages of investigating this disease, I think we were all hopeful that it was going to be very similar and that we'd, be able to find the variant and that kind of thing, but we just haven't been able to. So I think that, this is a disease that if it's caught early, it can be managed and it can have a good outcome, but there's just so many unknowns about it. And because it is bilateral, it really is a significant, concern for Friesian owners.
Yeah, that is definitely a concern. And they are actively studying this at UC Davis, correct? If somebody had a Friesian that was diagnosed, they could participate in the study, correct?
Yeah, Dr. Balone and I actually have an ongoing study to investigate it. So certainly if you in the audience, if you have your horse that's affected or know of anyone, please reach out to me or to Dr. Balone, and we can get you set up with the information that you need. It would be awesome to enroll a lot more cases and to be able to figure this out.
I have another question from Donna here. She says the vets did tell her that her mare has a lot of inflammation in the back of her eye, but they did not feel they needed to take the eye at this time. She wants to know, how would she know if her mare is in too much pain? She obviously wants to do what's best for her. She actually plugged the cornea with her iris and healed it herself for the time being.
Yeah, that's a really good question. And that brings up a good point in that the eye is pretty good at healing itself. Whether or not it can maintain vision in doing so is kind of always a question. But it sounds like if her corneal wound is healed, then she should probably be, pretty comfortable. Our indications to remove an eye are when an eye is irreversibly blind, so we know it won't see again, and it's a source of known untreatable discomfort for the animal. There are of course kind of caveats to that. Cancer would be one. If there's a tumor, those rules kind of go out the window, but I think monitoring for discomfort in a blind eye, things to look for would be, is she holding the eye open or closed? Does she have a lot of discharge? Are flies a problem from the discharge? Is she quiet? Is she sensitive when you touch that side of her face? Those are all things that can really indicate whether or not the eye is a source of pain for an animal.
I think that is our last question. So on behalf of the Fenway Foundation for Friesian Horses, we want to thank all of you for attending tonight's webinar. And we also want to thank you for your patience, because we had several unexpected technical difficulties, but we appreciate you guys hanging in there with us and understanding that sometimes technology just has a mind of its own, and tonight was one of those nights. But if you have additional questions, Dr. Knickelbein's email address is right there. Feel free to contact her, and keep in mind that she mentioned about the study that's happening on bilateral cornea stromal loss. So if you know of anyone, and even if you're in another country, I think usually we can, at least Fenway Foundation, I know we could help coordinate samples if we had somebody in the Netherlands that needed to get something shipped over. So we'd be glad to help connect you with the study. This webinar was recorded and we will add it to our website shortly. So you can explore this webinar or the hundreds of educational articles on the Fenway Foundation website in our library, and you can view them by going to www.fenwayfoundation.com. So thank you, Dr. Knickelbein, for being here with us and giving us this really important information for Friesian owners. Thank you all of you again for joining us tonight, and we'll see you at our next webinar, which should be in a few weeks. And so have a great night, and thank you.